The United States has announced its formal withdrawal from the World Health Organization. U.S. President Donald Trump threatened to leave the WHO and permanently cut funding to the organization back in May over disagreements about how to respond to the global coronavirus pandemic. Trump accuses the UN agency of, quote, pushing Chinese misinformation, although he had praised China's handling of the outbreak at the beginning of the year. The U.S. was the largest financial contributor to the WHO. Well, for more now, I'm joined on the line by Professor Paula Braverman. She's the director of the Center on Social Disparities in Health at the University of California in San Francisco. Thanks for being with us, Professor. Now, you are among 750 scholars and health professionals who signed a letter to Congress condemning the Trump administration's decision to withdraw from the WHO. Why do you think it's the wrong move?
Well, I think that if Trump succeeds, and that's not entirely clear, I must say, but if he did succeed with this, it would represent a huge step backward for humanity. I mean, the United Nations and its core agencies, including WHO, rose from the ashes and the horror of World War II, of the Nazi Holocaust and the atomic bomb, and it was a repudiation of hatred and brutality, and based on a recognition that either humanity would fall further into the abyss or people would cooperate and collaborate with each other and even support each other to achieve a better life for everyone. Unfortunately, the current president of the United States does not share these values, but I do think that most Americans do.
Okay, well, the WHO, of course, is concentrating on global public health, and Donald Trump is not alone in criticizing the WHO's handling of the coronavirus pandemic. Many say the organization was too slow, didn't give sufficient warning, failed to scrutinize what was happening in China. In short, that the WHO is guilty of gross negligence. Are these not valid criticisms?
I don't think that those are valid criticisms, which is not to say that things could not have been done better. But I would feel pretty comfortable venturing to say that compared with Trump's handling of the pandemic in the U.S., the WHO, I think, would come out looking far more adequate, and that really what many of us think that he's trying to do with this move is that he's looking for a scapegoat to hide his own incompetence, his dereliction of duty, and his total lack of compassion or empathy during the COVID pandemic.
But I wanted to focus on the WHO itself. Do you not agree that the WHO needs to be reformed?
I agree that the WHO needs to be reformed, but it is not a basket case, and there's much that's good there. And the argument that an institution needs to be reformed is not an argument for destroying it. And I don't think anyone has provided evidence that would lead us to believe that the WHO should be destroyed, should not exist at all.
Professor, thank you very much for talking with us. That was Professor Paula Braverman. She's director of the Center on Social Disparities in Health at the University of California, San Francisco.
My pleasure.
Now, the United States remains the country hardest hit by the coronavirus, and it's getting worse. Despite sharp rises in new COVID-19 cases across the country, many areas are going ahead with reopening. That includes the southern state of Georgia, where around 1,000 people are testing positive each day. But officials there are easing restrictions intended to control the pandemic. As public life resumes, African Americans are among those facing the greatest risk.
Things look like they're getting back to normal at Lake Allatoona, just 20 miles northeast of Georgia's capital, Atlanta. A lot of boaters are back on the water and nobody's wearing a mask. In downtown Atlanta and across the entire state, a growing number of shops and restaurants are reopening. Georgia is back in business and at work by order of the governor, but not so fast.
Man, put your mask on.
DeKalb County, Atlanta, a food drive, a fairly common sight these days. We're told that predominantly affluent African Americans live here. However, today, long lines of cars fill the parking lot again for a box of vegetables and a bag of frozen chicken breasts. One per car and household.
What's going on, big brother? I got it all. And if I ain't got it, I'll go get it for you.
This is John Beals. He's a chef and used to have a thriving catering business. Then COVID-19 hit.
Here I am on the corner selling barbecue.
Beals says the state's decision to loosen restrictions early and widely means he can work and feed his family. But of course, he knows about the potential health risks, and it makes him feel uneasy.
Now, how can you open a country with no cure? It's like sending people out to just kind of see what happens. In so many words, like guinea pigs.
African Americans living in Atlanta's historically underprivileged communities have suffered the most from the COVID-19 lockdown, and also from what many say was a hasty reopening of the state. They work low-paying jobs, live in so-called food deserts with no access to healthy nutrition, let alone quality healthcare or education. Yet, they are often so-called frontline workers with no other options for work. The coronavirus death rate of Black Americans is roughly 2.5 times higher than that of white and Asian Americans, and twice as high as the death rate for Latinos. We meet Pastor Anthony Motley. He says by reopening the state for business too quickly, the governor willfully put primarily African American lives in danger.
What we're doing as African American leaders and pastors, we're encouraging our people to social distance, shelter in place, use masks.
The pastor says President Trump is ultimately to blame for ignoring the disproportionate number of African Americans dying from COVID-19 across the country. Motley is convinced Trump will pay a heavy price for this at the ballot boxes in the presidential elections come this November. For now, he wants his congregation to stay home, urging them not to go to work or even come to church.